legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, March 27th. I'm Brent Anier. Busy week at the Capitol this week, with many TMA physicians advising lawmakers about bills in play. TMA is giving mixed reviews, positive and suggestions for improvement, to a proposal to modify the use of mediation to solve claim disputes. Senate Bill 481 by Senator Kelly Hancock would add assistant surgeons who are out of the network to the definition of facility-based physicians for the purpose of mediating claim disputes. But the bill also seeks to lower the threshold for mediation from the current $1,000 level to $0. Dr. Dawn Buckingham weighed in on the bill before the Senate Business and Commerce Committee.
We are all for the mediation process. We don't have any issue with assistant surgeons being considered facility physicians. But we do have some concerns about lowering the threshold for the mediation to below $1,000. We also have concerns that the Texas Department of Insurance, while there is legislation that has been passed previously that said that they have the right to monitor whether that networks are adequate, there's some significant evidence that shows that they are unable to do so currently. So we would like to see some increasing enforcement of laws already passed rather than creating increased bureaucracy for physicians to have to deal with.
The committee approved the bill lowering that threshold on Thursday. The state's Controlled Substance Registration, or CSR, would be eliminated under Senate Bill 195 by Senator Dr. Charles Schwartner, a TMA member from Georgetown. Two pain management specialists, Dr. C.M. Schade and Richard Hurley, told the Senate Health and Human Services Committee this bill cuts red tape to help physicians and patients.
This is a very important bill because it is moving to eliminate, in other words, to get rid of the controlled substance registration. The CSR is a duplicate process to our DEA license, and it's no longer needed. In fact, about half the states no longer use it.
Dr. Schade added eliminating the bureaucratic hassle doctors face in renewing the paper-driven CSR would reduce the likelihood of a doctor temporarily losing hospital privileges when the renewal gets stuck in the state system. It also would cut the threat of physicians' prescription identity theft and make renewal quicker and easier. San Antonio pulmonologist Dr. John Holcomb testified before the Senate Health and Human Services Committee this week on several important bills, including Senate Bill 200, the Health and Human Services Commission Sunset Bill by Senator Jane Nelson. The bill slows until 2019 the merger of the Texas Department of State Health Services and the Department of Family and Protective Services into the new HHS system. TMA supports the slowdown because a cautious merger helps protect the fragile populations these agencies serve. Dr. Holcomb also testified on Senate Bill 207 by Senator Juan Chuy Hinojosa, which ensures the accountability of the Medicaid Office of the Inspector General and the process for doctors accused of waste, fraud, or abuse. TMA has long argued the OIG would lump clerical errors and actual fraud together, often freezing Medicaid providers' pay while investigating. He said this bill ensures the OIG would more fairly accomplish what it should.
So now we think we've got it to a place where there is in fact due process. We can catch the bad actors, but we can leave the ones who are practicing good medicine but making coding errors alone, except to educate them and alert them.
Curbing minors' access to e-cigarette products is the focus of 5 bills Dr. Jason Terk spoke in favor of at the House Public Health Committee on Tuesday. All of these bills aim to decrease minors' access to e-cigarettes or to regulate their availability and use, like prohibiting their use at schools. Dr. Terk says physicians support these bills because they protect the public, especially children.
For children, our standard has to be what's the right thing based upon the best available evidence. And we do know that e-cigarettes have harmful products in them, including formaldehyde, which is a carcinogen. We also have a concern that these products are transitional products toward using tobacco products later on.
Houston emergency medicine physician Dr. Arlo Weltge testified Wednesday at the House State Affairs Committee on House Bill 614 by Representative Sarah Davis. The measure would require Texas to establish an advanced directives registry. Dr. Weltge thanked Representative Davis because having easy access to patients' do not resuscitate orders would be helpful in urgent care situations. But he also raised some questions and he offered some suggestions for improvement.
There are wonderful opportunities for this bill. We need to make sure, number one, that there are appropriate protections for physicians and families to use it. We need to make sure that it's current, that we can identify the patient, that it's the right patient at the right time and the right information.
Before we go, a reminder to plan now to attend TMA's First Tuesdays at the Capitol in just over a week. That's Tuesday, April 7th in Austin. That's all for now. I'm Brent Anier with TMA. Please join us again next week for TMA's Legislative News Hotline.